Hi everyone and welcome to another case. Unfortunately, this is a young patient with planocellular carcinoma of the oral cavity that's destroying the mandible. If you have any questions, please feel free to contact me or send a message or write a comment, whatever you want. I'll start with adjusting the window. Okay, this will be okay. And now I'll perform a segmentation. Because of the privacy, I won't write the name here. I usually do. I'll do it after the recording. Okay, now you can stop if you want, but I'll just as a showcase, I'll segment a tumor of the patient also, but it is not of importance for this procedure. Over here you can change the colors if you want. You can search here and write. Okay, now let's make tumor like mass. Okay, select and then we'll change. Okay, better depiction. the segmentation of the mandible and the tumor. The fibula and the peroneal artery are next for the segmentation. So I will correct the window for the segmentation. Okay, so fibula, right fibula looks good. The peroneal artery and the rest of the vasculature of the lower leg, not so good, but that is not important. It is just for orientation in the space after when we'll perform the modeling of the guides. So now I will save the model. I saw that there is a good perforator right here. So just in case if we decide to take the left fibula instead of the right. closing these holes because of the process of cleaning the model when I will import it into the blender later on. I want to erase the inner vertices that will live inside of the cortex, and if these small holes are visible and present, that means that they're connected with inner parts, so I will not be able to erase those facets. So I do it in 3D slicer, but you can do it in software, modeling software like Blender or Mesh Mixer. Okay, you saw that the segmentation of the left fibula was a little bit faster than the right one because I had a little bit different approach. And now I will save the models, and the next step is meeting with the surgeons, and they will decide where to put osteotomy planes, and we will perform virtual surgery. After the segmentation, I have cleaned the models of the mandible and fibula. We will use left fibula for reconstruction and for harvesting the graft. So you go to add-on, FFFGen, initialize add-on, import your models. Okay, scale 0.1, same for fibula. I'm not sure if I mentioned this, but the condyles of the mandible should be faced to a negative y-axis, and the mental process should be faced to positive y-axis. So go to apply all transforms. Okay. I'm not sure yet. Okay, all transformation. Go to FFFGen. You choose mandible for mandible, fibula for fibula, and this is the plan for the patient that we discussed together this morning with the surgeons. So the plan is to have also two segment graft, longer graft on the body of the mandible and one shorter segment on the mental process. So osteotomy planes should be somewhere like this. We will take the left fibula
because of the better perforators and the better status of the peroneal artery, the osteotomy should be somewhere like here, 6 centimeters for the distal part of the malleolus, and yeah, this is it. Okay, as said in the plan, we will have two segment, press the auto decimate and initialize add-on objects, sorry. So like that, auto update on, so we have real time I will measure at least 6 centimeters of the fibular malleole, so we don't go any closer. Okay, that should be. One, two, three, four. The osteotomy will be here between the third and the fourth tooth. Okay, let me check the plan just to see if we are okay on the right side of the mandible, and to see if this is correct placement of the osteotomy plane. Yes, this is okay. This is okay, this side, left side, and the right side needs to be a little bit more further here. This won't be ideal. It's not ideal, but the surgeons wanted to have two-part graft, so I think this is the best option. Yes, like that. I will move. Okay, so we are safe here. Let's see how far is the two. Okay, 7 millimeters. This should be okay. Okay, so we will choose salt thickness and put it on 1.3. I went to visit the surgeons this morning and show them how the fragments supposed to look, and I wasn't satisfied. Maybe you could hear me yesterday mentioning that, but yes, this this part here where the two segments meet, it was more like it didn't follow the curvature of the mandible. So we were thinking of making 3 segments or 2, and decided to still make 2-segment mandible, and they yes, we are aware that uh, there will be a 7 millimeter mismatch between natural curvature and reconstructed bone, and this part here will protrude, but they will shave it off and it will remain smooth. So I have, let's see, did we, no, we didn't generate, I didn't generate the cutting planes, so everything is the same. Auto update is still on. Plane thickness is 1.3 millimeters, and press generate planes. So let's go here. We will make, again, we will move a little bit proximally, and same for the distal part, just to fill the gap that the saw thickness is making. Okay, and then go and press again create fibula. So let's make the guides. Okay, like that. Let's see if we are on correct side. Yes, we are. Okay, spread ZZ like that. Scale ZZ like that. Surgeons told me that they want to have a screw hole so the guide can be fixed on this segment, because when they make osteotomy on the proximal and distal part, it is not connected to the rest of the bone, so it is hard to cut here in the middle. So I'm adding the holes here. I'm trying to put it as low as I can, because in the holes of the connecting plate will be somewhere of the lower half of the shaft. So okay, this looks nice let's see, there is enough space between the bone and the guide, so can make a full passage through the bone to the cortex. Okay, and this looks good, and I will save it now. Okay, so we're finished with the fibula guide. Let's do the mandible guide. Again, move the cutting plane only in its local axis. So grab ZZ and this should be it. Let's scale ZZ, the whole guide. Grab ZZ. We have to move ZZ. Okay, we'll scale it a little bit more. Okay. Yes, this is it. There is no scale axis. Okay, I think this is it. I think that, okay, later I will delete this part because it is not connected to the main part. This here and this one, yeah, it's good. They will remove 1, 2, 3, 4, and 5th tooth because of the cutting plane, and think okay, let's create mandible. Okay, screw, grab, let's put it here. Yeah, you can change the screw hole diameter depending the screw types you use. Okay, this is good. Let's put one here. Okay, let's join the mandibles like that. Okay, this looks good. I will cut the bottom part and make it flat. I will try to add some photos of the cutting guide during the operation and how it fits the whole mandible, but it should be fairly good. Unfortunately, I don't have photos of the cutting guides during the surgery because I wasn't there. My colleagues told me that unfortunately, in the period between the CT scanning and the surgery, the tumor increased in size, so they had to widen the area of the resection. They used the same angles, just move the cutting plates further back. Same for the angular part and on the body. They did wide the fragments of the fibula, and they used the same angles as we planned. So there wasn't a big discrepancy between the initial plan or virtual surgery and the operation. Thank you guys. Like, share, and subscribe. Bye bye, and see you next time.